For people with sleep apnea, heart disease is a real concern. Sudden drops in blood oxygen levels put a strain on the cardiovascular system. Joining us now, Waco cardiologist Dr. Sean Skeen. Dr. Skeen, thanks for spending some time with us about this. Now, you tell me that you have patients come to your office and you talk a lot about sleep.
I do. It's probably one of the things I think patients aren't aware I'm going to address when they come to visit with me. But over the last decade, we've started to see the impact of poor sleep habits on cardiovascular risk factors and cardiovascular health.
Well, sleep apnea, we've talked about it on the show before. Generally, the symptom is snoring, but a lot of people who have it don't realize they have it.
Exactly. You know, one of the things that I like, at least to try to do, is get a feel for the people in their lives, what they think about the patient's sleeping habits. Is there irregular breathing? Is there snoring? During the daytime, do they fall asleep constantly while sitting at a table or riding in a car? Do they have a lot of fatigue and just never feel rested?
Well, can damage to the heart from sleep apnea be reversed if they find out about it and maybe get it treated?
Absolutely. A lot of times it can, particularly early. What we want to do is treat the sleep issue while we're still managing risk. At some point, poor sleep habits can result in actual disease, cardiovascular disease, heart attack, stroke, even some pulmonary and heart arrhythmia issues. And we would much rather address that early while we can prevent rather than treat.
Well, it may be a surprise to some folks to hear how correlated these two issues are, but I know from personal experience, because I'm going for a sleep study. I just found that out yesterday, because I have that irregular sleep pattern and I have a little bit of blood pressure issue. And I'm kind of thinking, oh man, am I going to be able to fall asleep for a sleep study in some foreign place with stuff stuck all over me?
There's so many different ways to do sleep studies now, which is kind of nice. In the old days, it used to be you go to a sleep clinic or a hospital and you had to stay there all plugged up and people watching you and monitors. There's actually some options now for getting your sleep study done at home. And that's why when I talk to a lot of patients, I want to dispel some myths about what they heard 10, 20 years ago and say, no, these are kind of the options now, and let us get you with a sleep physician that can offer you different things that may suit your lifestyle better or your sleeping habits better, so that we can get an accurate study and actually start working on prevention and treatment.
And there have been a lot of advances, I know, as well in treating sleep apnea.
Absolutely. Not only is this now an issue we see in the primary care clinics, clearly we see it in the cardiovascular disease clinics, the pulmonary clinics, and our colleagues in the dental world are now helping us out, not only in recognizing but also treating.
Well, this is something there was a study, I understand, that kind of made clear this correlation. I think everybody sort of kind of knew there was a correlation between snoring and kind of stopping your breathing and what that could be doing to your heart.
Right. Over the last decade, we've kind of put together the evidence of what happens in the body when we're not sleeping and breathing. When the oxygen levels drop, it puts your body under stress. Your body under stress is going to create stress hormones. That ultimately raises blood pressure, puts arrhythmias, or puts you at risk for arrhythmias, blood sugar regulation gets off, obesity and fat deposition goes up. So we knew this was happening, but we didn't always have a direct impact on the cardiovascular system. This study in Nature showed, at least in mice, that we now have at least a causal effect of plaque deposition and fatty deposition in the arteries as a result of hormones in the brain that are dysregulated during sleep.
So how can folks get more information from you?
First of all, if your family's telling you to wake up and roll over, please go to your primary care physician first and bring that up. Sleep apnea websites in the Mayo Clinic, as well as Waco Cardiology Associates. Please get on our website. We'll redirect you where you need to go, and be happy to help and see them anytime.
Oh, thank you so much,
Yeah,
Dr. Skeen, for being with us.